because we don't have all the tools sometimes to make diagnosis and things like that, we definitely have to rely a lot in the clinical information that we have from the patient. So for example, here you will get like images or additional studies to determine for sure or to be certain of specific cases, right? And there we may not have that type of imaging. We may not have the same information that you will get here. Specifically, MRIs are very expensive in the Dominican Republic. So not every patient, even if you want it, or here it's a kind of a protocol for certain things. Oh, everyone needs to get an MRI. If you get X diagnosis, you will get an MRI. If you have a suspicion for X, Y, or Z, this is the imaging that you get. There, you don't have that. So you have to rely a lot in other indicators.
So basically, do you think like it's more of like lack of funding in Dominican Republic compared to the US, like where doctors there have to rely on their judgment because they don't have the resources to obviously do some certain procedures?
Definitely. I think due to lack of that has a lot to do with the way that we practice in the Dominican Republic. Yes.
Speaking about differences again, are there any differences that you have noticed between your colleagues who did their medical school in the US and those who did it in other countries like Dominican Republic, perhaps?
At the beginning, you start approaching the cases. My approach was completely different to someone that was at the medical school here, right? So as I train in residency, my mind and the way that I see and treat patients, of course, shifted to the American or the North American way to treating the patients and making diagnosis and things like that. But at the beginning, it was like, okay, this is how I did it in the Dominican Republic as a medical student, and it was fine. It was okay. Here, definitely, the protocols that you have and things like that definitely help you fine tune all that information that you have in your mind that you are trying to get to. Yeah, so I think that's the way. That would be the only way that I think it would be different.
And on to my last question. From like all your years of living in the United States, what do you think is the best advice you can give to people looking to move here and pursue a career in the medical field?
Well, be persistent. And I think that's the most important advice that I could give anyone that really wants to complete their medical career here in the United States. You need to have a goal, set your goal, and don't set short-term goals. No. You need to have short-term and long-term. You need to know what you're working for. You need to know where you're going to. So if you prepare for that, for where you see yourself in 10 years, 15 years from now, you work towards that goal and don't give up. Don't take a no for an answer. If someone says no here, okay, look somewhere else, because that will be your persistence. And being determined is what gonna take you to the next place. So I did struggle a little bit at the beginning. So I have to say, preparing for the steps and not having research, because we don't do research, or at that time, again, we didn't do much research in the Dominican Republic. I didn't have any letters of recommendations from US doctors and those things that are so important to have here, or clinical experience in the US either. That's why I looked for a job in research to try to have some papers, some publications, and then look for mentors that can help you and can write letters for you and can introduce you to others that can help you in your journey. It's very important. Knowing that if you are coming from a medical school outside from the United States, having someone that can help you find research, mentors, and write excellent letters of recommendation for you. It's so important to do and to find.
Yeah, I think being persistent applies to any field, and also finding connections, whether that be a mentor, a friend. Obviously, you can like find different opportunities from that. Well, it was great chatting with you, Rosa.
Thank you, Justin.
Yeah.
Thank you for the opportunity.
Hi, everyone. This is Renee here with Marina, and today we'll be talking to Joseph Furiolo. Joseph is currently a plastic surgeon resident at UC Davis. He was born and raised in Sydney, Australia, where he completed medical school at the University of New South Wales. After that, he completed his research fellowship in pediatric plastic surgery at Boston Children's Hospital in 2018 and matched to the UC Davis program that same year. Hi, Joseph. Thank you so much for being here with us today.
Yeah, thanks so much for having me on the podcast. And I'm excited to get talking a bit about medical school in another country.
We're happy to start talking about that too. So let's get right into it. First of all, could you tell us a little bit about medical school in Australia and how it compares to what you know about medical school here in the US?
Yeah, so it's there are some big differences. First up, we have two main ways of getting into medical school. There's the traditional 4-year medical school after an undergraduate degree, and then there's also the option to do undergraduate medicine, which is what I did. So undergraduate medicine implies that after high school, you go into a 5 or 6-year program that integrates an undergraduate degree at the same time as teaching medical school. It's a little bit accelerated in that sense, but at the same time, you spend a lot longer in medical school than the traditional 4-year person. So I would say the split between the medical schools is about 50-50 in Australia. So if you're coming out of high school, you can apply to about half the medical schools. And if you're finishing an undergraduate degree, then you have access to the other half of the medical school. So that's one of the big differences. I think another one is that we have a lot fewer medical schools. So it's unlike UC Davis, for example, where the medical students will be attached to that main UC Davis Medical Center for the most part. We actually covered a big geographic region in Sydney, Australia. So we rotated at quite a number of hospitals and drove quite large distances around the city as well. But I think in terms of, what it really comes down to and, learning to be a doctor and the basics of taking a good history, a good physical exam, that's all consistent among every country, as is the standard didactics portion and basic sciences. So there's a little bit difference in the mechanics of medical school, but I think it gets to the same point in the end.
Wow, that's really awesome and way different from like how it is here, and so unique and like it works out.
Yeah, I think it's great if you're someone who knows what they want to do at a young age, then it helps you get there. And if you discover that you are interested in a medical career a little bit later on after high school, then there's also that option as well.
Yeah, based on what you've noticed, do you think people tend to go straight to medical school, or do you think they like kind of take a break in between?
Yeah, I think it's increasingly common to take a gap year after high school in Australia, especially if you want to go into medical school. And in some regards, that gap year might be to make yourself a more competitive applicant. And in other regards, people just want to take a gap year to have a break and travel and, just after the peak of high school, not necessarily get thrown into an intense degree. So I think a gap year is always a good option. And, in some sense, I did that with my research as well.
And for you personally, how was it going straight from high school to medical school right away?
It's not the easiest transition. Anyone in medical school would tell you that the learning it can be very self-directed, as can learning in residency. And it's very true, even though it is an undergraduate degree. However, being an undergraduate degree, the majority of people I was with were directly from high school. So the faculty knew that very well. And the curriculum and the way didactics were designed did account for that fact. So, they made every effort to make it as approachable as possible. But I think no matter what path you go into medical school, it is a entirely new way of learning. It's a large volume of content that you have to learn in a small amount of time. And whether it's coming from high school or an undergraduate degree, I think is challenging. So at some point, you just need to be thrown into it.
Yeah, for sure. How do you think your education in Australia shaped you professionally and personally?
Yeah, I think it's a different health system. So, some of my expectations and ideas of what healthcare should be were certainly challenged and contrasted coming to the United States. In Australia, we do have universal healthcare. And so a lot of the insurance issues that I encounter as a resident and have to work around was something that I wasn't prepared for with my medical school. At the same time, in a system with universal healthcare, I think there's a lot more of an emphasis on decreasing costs. So things that we would routinely order in the United States, like a CT scan, needs a lot more discussion and a lot more convincing of your radiologist in Australia. So if you want to order a CT abdomen, you really have to put forth the case as to why this is an important test and why it's the best test and why it's going to help, or how it's going to help the patient and change your management. And often, this is just an example of radiology, but the radiologist might come back and say, well, I don't think that's a good enough reason, or, there's perhaps a cheaper test that you might want to try first. And so in that way, I think that medical school in Australia certainly puts a lot more emphasis on history and physical exam, and then really makes you have to justify any labs or additional investigations that you'd like to order. And so that was a bit different as well. Coming here, it's, when I'm on facial trauma call, we routinely get a face CT for every patient, and that's not necessarily true in my medical school or in Australia in general.
Did you always see yourself starting your career here in the US, or did you have other countries in mind?
Yeah, good question. I honestly, for most of medical school, just anticipated that I would be staying in Australia. And more than anything, I think it was American plastic surgery that drew me to the United States. Once I knew that I wanted to do plastic surgery, I had a look at the various pathways into plastic surgery. And in Australia, they typically only train, 10 to 20 residents a year that they take in. And in comparison, there's nearly 200 residents that match into plastic surgery each year in the United States. And I think, the match system in the United States, I'm sure, is flawed in some aspects. But for the most part, it is merit-based. There's a standardized test, the USMLE, step 1, step 2, step 3, that people may be familiar with. And those scores certainly are an objective measure of you as an applicant. They look at things like research and other extracurricular activities. And in Australia, it just seemed like a lot of the people who matched into plastic surgery were maybe just the people who waited the longest or knew some of the key plastic surgeons the best. So I was attracted to the United States in the sense that I thought there was more meritocracy. And then when I actually was interested in plastic surgery, I came and did some sub-internships. And I'm not sure if you're familiar with what they are, but usually in the final year of medical school, you get the chance to do some elective rotations in your specialty of interest, but typically you can do them at any hospital in the world that really would be willing to take you. And so I decided to go to the United States. I'd never been, and I've always been interested. And initially I went to Boston Children's Hospital for pediatric plastic surgery. And then I followed that with a rotation at UCLA just for general plastic surgery. And especially at Boston Children's Hospital, which is where I ended up working for a couple of years as a research fellow, I really did fall in love with pediatric plastic surgery, craniofacial plastic surgery. And so it was basically as I pursued those research opportunities at Boston Children's and got a job there, I then decided that I would like to stay. And so then that's kind of how I found my way getting involved in the American match system and then eventually matching at UC Davis.
Yeah, so right now you're going through the residency program at UC Davis. Do you feel like it's a fairly diverse program with students from other countries, or?
Yeah, it's actually interesting. So it's a small program, so we can only be so diverse. We can't represent everyone. There's only 9 of us. So we have, in terms of diversity and as far as where people are from, as far as I'm aware, I think 4 or 5 out of the 9 of us are born in a foreign country. A couple of my co-residents born in Asia, one in the Middle East, and obviously me in Australia. So we definitely have that diversity. We do have a bit of educational diversity also. Typically and historically, plastic surgery was surgery that was pursued at the end of general surgery training or at the end of another surgical training. And what people would do is follow that up with a 3-year plastic surgery education. And so we have 3 residents in that 3-year program. The newer model of training involves the 6-year training program that I'm in. And so the people going to the 6-year program go into what's called an integrated residency. And the general surgery program is basically integrated into the plastic surgery program. So most of us will come directly from medical school. I came obviously after a bit of research, but the main idea of that is that we don't have to complete another residency. So there's a bit of diversity in terms of where we're from, definitely people from over the country, and then, where we came from educationally also.
Yeah, do you feel like you can relate to the other students from different countries and even with different educational backgrounds?
Yeah, definitely. I think, we are in a pretty sub-specialized field. And so I think just that alone gives us a lot more in common than we have different. And I think it's been enriching to have people from different countries and different parts of the country. I don't think it's really put up any barriers at all. And, I like to socialize with my friends in the residency who have something different to bring, whether it's in terms of food or culture or anything like that. I think it just strengthens the residency. And even, interacting with patients, it really helps. One of my co-residents did some general surgery training in Southern California. And in that time, he learned how to speak Spanish. So he's great with a lot of our patients who are Spanish speaking only. And then there are other languages that some of our other residents speak as well that have really broken down some of those cultural barriers between our patients and allowed us to better communicate. So I think it helps within the residency socially, and then also ultimately with how we treat patients.
Do you plan on returning back to Australia once you're done here, or do you see yourself living somewhere else?
Good question. So I think ideally, if visa circumstances permitting, it would be great to stay in the United States. I think it does have a unique set of academic opportunities that are hard to find elsewhere. Whether it's Australia or really any other English-speaking country, it's very hard to find this density of academic centers that hire quite a number of plastic surgeons and allow them to do, not only plastic surgery as a service, but also plastic surgery research and innovation. It's quite difficult to find that in other countries. And, in Australia, I'm only aware of a couple of plastic surgery labs that are, really making big contributions, which is very different to how it is here. This weekend, for example, I'm going to the American Association of Plastic Surgeons meeting, and just looking at the scientific program there and how many different distinct academic centers are represented is very remarkable.
From your time in the United States, what do you think is the best advice you can give to people looking to move here and pursue a career in the medical field like you did?
I think the most critical thing is to maybe two most critical things. One would be to move to the United States. It's very hard to really match into a residency without, networking and making contacts, and, importantly, just learning about the country that you will have to live and work in. And the other would be to get a mentor. And I think, a good mentor is invaluable. You can find someone who can, help you explore the scope of your specialty, but, it's very common for foreign medical graduates like myself to do research just to strengthen the applications to get in, because it is seen as a negative in your application to not be from an American medical school. And just having a mentor can really guide you through a lot of nuances of the process. I think being an American in an American medical school sometimes you don't realize the advantages you have, even if it's just in the USMLE exams and being able to form a study group and study for those exams effectively, or if it's about doing the correct rotations and getting letters of recommendation. Some of that stuff is not as straightforward as a foreign applicant because you just don't get those cues from your medical school or your environment in general. So I think, move to America, get a mentor. And it sounds like a bold step, but interestingly, I think a lot of people are open to receiving emails and just listening to your story. And if they can't mentor you directly, they're usually pretty happy to refer you to someone who can. So I would encourage people to, read actively in your specialty, see who's writing about what you're interested in, and then contact them to see what opportunities they may have or know about.
Great. Yeah, I have a couple of follow-up questions, actually. Thank you so much for all the knowledge that you've been sharing. I think, a lot of people can really relate to a lot of the questions that you raised in terms of the process of coming to a new country and building up that network. And then on that same note, what's it like being here? Do you have, a pretty firm social network now that you've been in Davis a while? And then how is it being pretty far from home, and is that difficult?
Yeah, so in terms of social network, it has been challenging at times. Firstly, when I moved to Boston, I didn't necessarily know anyone. So that took, spending a couple of years there, it took me a while to build up a social network. And maybe the stereotype's true. Maybe Californians are just a bit friendlier than people in the Northeast. I'm not sure. But definitely friends through work, friends through, shared experiences. Definitely made a lot of lifelong friends with some of the people who were also research fellows at the same time as me, or who were residents. So definitely easy to set up, those kinds of relationships when you share something in common, like interest in the same specialty. Moving to California, I think residency is very easy to make friends in. Typically, you're around a bunch of people the same age as you. Everyone, well, nearly everyone for the most part, just moved to that city also. So the way things are set up, it would be hard not to make friends. And so, yeah, being in Sacramento for nearly 3 years at this point, I do have a great social circle. Unfortunately, one of the realities of residency is that every year people graduate. So you do lose friends along the way, but hopefully with the new people who come in, you make some new ones also. And sorry, I know you had a second part of the question.
Yeah, the second part is, how do you stay connected back home? I think for some international students, either the flight or, the time difference isn't so bad depending on where you are. How's that to Australia, and how do you manage that?
Yeah, so, I think the biggest challenge obviously has been COVID in the recent times. That has prevented me from being home for the last 2 years or so. But typically I would, aim to go home about once a year, maybe a little more frequently if possible. The flight to Australia can certainly be a barrier. It's about 14 or 15 hours from Northern California to Sydney Airport. So that can, it's obviously not possible to do a weekend trip or anything like that. And the cost can also be a huge barrier. But I think with things like, just modern communication technology, I have WhatsApp group chats with my family, FaceTimes, all that kind of stuff. Really just like how I would with anyone else. The good news is that for the most part, the time zones are so different that they nearly come back to each other. So Australia is about 19 hours ahead, which basically means we're kind of just 5 hours ahead, but in the previous day. So it's not too bad in that regard either. And then, hasn't worked out so far in residency, but definitely my research fellowship, I had family come visit me also. So hopefully when, COVID things clear up, physical visits are a bit more realistic. But in the meantime, it is very plausible to stay in contact with your family and friends at home.
Great. Well, thank you so much, Joseph. And we are really excited about this episode. And I'm sure that a lot of people can learn something from what you shared.
Yeah, thanks so much for having me. And again, thanks for forgiving me for my lateness. uh, I hope that, people do listen to this and especially, the other interviews that you have with some of the professors with their knowledge about foreign medical education. It is, it can, like we covered, it can be socially and academically challenging to make the move to another country. But I think, like I said, if you can try it out, move to the United States for some time, and once you learn that you like it, there are, some good strategies to follow to make it work for you.
Thank you so much. That was really awesome to hear from you. And I really enjoyed hearing your story, and just all your experiences was wow. Thank you.
Yeah, thanks so much.
Fantastic.
Yeah, definitely.
Great. So those interviews were all really interesting, and I think they gave us a lot to think about and mull over. And so now we wanted to hear a little bit back from our interviewers, Kaden, Renee, and Justin, and myself, about what we thought about people's responses and what it made us think about global education in general and med school in particular. So Kaden, what were some of the things that jumped out to you during each of the interviews that we did?
I thought it was really interesting, the different backgrounds everybody had coming into medical school. It was interesting seeing how it could kind of be like an unexpected route. So, Dr. Martin obviously coming in as an engineer and then switching to go down the surgical path, and Dr. Rodriguez not even planning to have moved to the United States, but having made that transition nonetheless. It was just really interesting, the themes of kind of persistence, and obviously there's a lot of logistical traveling obstacles that can come in their way, but it was really interesting hearing everybody's process going through all those logistics and coming out on the other side better for it, and having learned a lot from those various challenges, but be they linguistic or just cultural in general, and it was pretty inspiring.
Awesome, thank you. And Renee, what were some things that were either specific to the interview with Joseph or generally what you got from the other two interviewees as well?
Yeah, what I thought was really amazing is it was a good representation of maybe different backgrounds of their different countries of origin, but talking to them and hearing their stories, it really felt like you can't really pin down any experience to any region, and it really seemed like everyone had their own experience, and it was really amazing just to listen to it. All these people from outside the US coming here to pursue a certain career, they had such different stories, but yet they had also so many similar things, such as struggles in trying to find a mentor. At the end of the day, it was just, everyone kind of had the same similar mindset and had the same amount of passion for the field that they were entering. Above all differences, it was just really amazing to see that.
Yeah, actually, it's really interesting that you said that it's, the observations from the different interviewees isn't specific to a particular region, because I think it was really interesting to see how Joseph was basically saying, okay, one of the drawbacks of public medicine is that you don't have the option to rerun tests and, order tests that might be kind of extra. And you have that same issue in the Dominican Republic, even though it's very low resource, it's kind of for a different reason, is that they just don't have access to some of the equipment that's available. So you're running into these similar problems of, not ordering a specific test, but they're for very different reasons. And then also, I think that there's a lot of difficulties in different countries based on specialties that could be resource-based or could be based on the focus of that country, coming up with a preference for, whether or not they're funding the education for that type of specialty. And Justin, what were some of the things that came up either during your interview with Rosa or some of the other interviews that you listened to?
Yeah, I think the most interesting thing I found was that since all three of our our guests came from 3 different countries and started working in the US, they all face cultural differences in the country and also cultural differences in the medical field. Like you mentioned, how Rosa described when she was working in the Dominican Republic, there was resource issues that made her had to conduct her work a little bit differently. And when she came to the US, there was a whole complete shift and she didn't even plan on going to the US first. And yet she overcame it and is now very successful.
And I think, it's really interesting too, because on the one hand, there is maybe some sense that not ordering these tests might be detrimental in some way, or not having this equipment might be detrimental. But then we can also think about kind of the flip side of that, right? So in the Dominican Republic, in the spaces that Rosa was operating in, basically, they had to sometimes use materials that here you might just throw away. And we can think about that actually from like a sustainability standpoint. That's actually better than just opening up a package that maybe has, 50 feet left of gauze or something like that. And because it's open, now you have to throw it away here in the US. Whereas, in the Dominican Republic, they reuse those materials. And I actually had that same experience when I was working in a lab in Mexico City. We were reusing pipettes. And what we would do is once you use the glass pipettes, then you would wash them, rinse them, let them dry, and then we would autoclave them. And here, those things are a dime a dozen and you just toss them out. And on the one hand, it was great because we're reusing those and not just throwing them away all the time. But then on the other hand, it's more dangerous and there is some issues with still cleanliness. And for example, when I was washing the pipettes once, I broke one and it like lodged in my finger. And so there's kind of these many different issues of resources, practices, culturally appropriate standards, all of that. So it's really interesting to see how that changes and also understand that it's not that one is necessarily better than the other. And I think, obviously we have kind of the quote unquote survivor bias, right? That all of the people who we interviewed are people who came and stayed in the US to be medical doctors. So their experience is going to be really different. And the things that they care about in the field of medicine are going to be really different than somebody who is from their country, who stayed in their country and practiced medicine in their country. And so I think that we always have to have that kind of in the back of our mind. Well, thank you guys. And I really appreciated all your effort on this episode. So until next time, this is Aggies Near and Far.
Hello, everyone. Thank you so much for listening, and we hope you all enjoyed this episode of Aggies Near and Far, a podcast dedicated to fostering global education for all at UC Davis. The information contained in this podcast represents the views and opinions of the original creators and does not necessarily represent the views and opinions of the Aggies Near and Far organization. We are always looking for students interested in furthering our mission to foster global education for all at UCD. If you are a student who has studied abroad, a student from another country, or are just interested in intercultural exchange, we'd love for you to share your ideas for episodes with us. We're especially looking for students excited about sharing their experiences, conducting interviews, and illustrating their respective cultural events and significance. If you'd like to join our mission or just know a bit more about us, you can look us up as Aggies Near and Far on UC Davis Aggie Life, Facebook, or Instagram, or send us an email at aggies.near.far@gmail.com. This episode and others can be found on our Spotify, SoundCloud, iTunes, and Stitcher.